I'm very passionate and excited about our trauma therapy program. For years, we've lived among Syrian refugees, people who fled from the Syrian Civil War, and we've seen the trauma that they're carrying, the anxiety and the depression, the PTSD, and we've been praying for the Lord to send a trained trauma counselor to help them with their trauma. And the Lord has put it on my heart to be that trained trauma counselor. So after finishing my studies in trauma counseling, we've begun a program in Tyre. The program is based around a clinical treatment called EMDR, and it's actually used by the Veterans Administration for veterans who are returning from war and have PTSD. So it involves having the people remember their traumatic events and at the same time do bilateral stimulation. They may pat their shoulders like this, or they may do something we call the butterfly hug. And that back and forth stimulation, it simulates when a person is sleeping and their eyes move back and forth while they're dreaming. The idea is to encourage your brain to process all of those traumatic memories. This program is really important to the refugees because there is a lack of mental health care among refugee populations. The World Health Organization, in fact, has called it a mental health gap. And they've identified the reasons: lack of training of people, lack of money for the treatment, and so we're trying to step into that gap that's been identified in mental health care among the Syrian refugee people. The people who come to Lebanon, the Syrian refugees, have lost things in the war. They lost their homes, they've lost members of their family, they've lost their jobs, they've lost hope. I think hope is the most powerful thing that we give to people, because with hope they can face the future. I really love this program. I'm passionate about it for two reasons. One, it's very effective. We've seen people's trauma scores reduced during treatment. We always assess the effectiveness of the program while we're treating people, and we see their trauma scores go down as they go through the program. And also from what the people tell us about how the program has helped them. In one of our more recent sessions, there was a woman who went through the program, and after it was over, she told me, at night, I would sit around and hold myself, and I would rock back and forth, holding myself to try to make all the pain go away. And she said, since I've been through this program, that hasn't happened to me at all. And she's just so grateful that she's been healed of her mental trauma. Part of the program is follow-up assessment. We don't just treat people and then never see them again. We go back into the camps, we talk to them, we're part of their lives. We do follow-up testing. Assessments that tell us their trauma scores. And so we've seen people's trauma scores go down by testing, but we've also been back to the camps and seen how people are happier in their homes. They have better relationships with their families. They're not constantly in pain like they were before. They have hope in the future, and they're able to get back to their normal life. That's one of the main goals in clinical mental health care, is to not have a person forget the traumatic things that have happened, though that won't ever happen, but to take away the pain and the frustration and the suffering so that they can get back to their normal life. The second and most important thing that I love about this program is that it glorifies Jesus. Jesus is glorified in the healing of the suffering and the healing of the sick, and we give credit to him for this program. We encourage people as part of the program to address their spiritual traumas and spiritual needs also. We say, Jesus said, "Come unto me, those of you who are weary and heavy laden, and I will give you rest." And it's in that rest that we find hope. Our goal for this ministry is not just to be one person helping people. We're already training local workers in techniques that they can use to alleviate trauma in the people that they deal with through their ministries. We want to train them to train other people. So we're hoping to see this program grow into something that affects the whole region, that brings healing to tens of thousands or hundreds of thousands of people as the network of trained people grows. We would also appreciate any financial support you could offer. We pay for training and equipping of our local workers. If you're interested in supporting us financially, you can send your donation to our Words of Isa, P.O. Box 1398, Albertville, Alabama 35950. As with everything that we try to do in our ministry, we want to see Jesus lifted up and glorified in what we do. We want to see him glorified in the lives that are changed, in the people that are healed, in the hope that is given for the future.